Hello everyone, myself Dr. Gaurav Mhaske. Today's topic for my presentation is sensory examination. My contents are introduction of sensory examination, what are different type of sensation present, what are the sensory pathways, and what are the clinical examination. Objective for my today's superficial examination is to understand the basic concept and a type of superficial sensation, to identify the sensory receptors involved in superficial sensation, comprehension and the sensory pathway from the receptors to the brain, and learn how to conduct a clinical examination for superficial sensation. Sensation is the basic type of our life where we can feel, we can see, we can hear, we can get touch. But during sensory examination, it is all the evaluation of pain, temperature, light touch, position sense, vibration, and 2-point discrimination sensation. Now, this sensation is carried from a brain pathway to various organs, like to our tongue, taste, ocular for visual, smell, olfaction, vestibular system for balance, auditory for hearing, somatosensory like there are 6 senses like temperature, pain, balance, mechanoreceptors, proprioception, joint position sense, that is kinetic sensation, sensation of force, and sensation of change in velocity. This pathway is carried from the brain to the peripheries. So we can say from center to the peripheries. So in this more important is like light touch. Light touch goes with the sensor receptors, which having A beta fibers, which go with the sensory pathway with spinothalamic tract. Pressure by sensory receptor panic corpuscles, A beta fibers goes with spinothalamic tract. Pain, pin pricking, free ending nerves, A beta fibers, or also by nocistimulators, receptors by tract C fibers, temperature by thermoreceptors, A beta fibers, C fibers by spinothalamic tract. There are different also sensation carry with vibration, which is called with the dorsal column of the sensory pathway by the nerve fibers of A beta fibers, proprioceptions by spinal bundles, referent ending by A beta fibers by dorsal column, touch localization by A beta fibers by dorsal column, serignosis and graphesthesia by hemisphere, which carry the tracks from peripheral to center. So these are the pathways of somatosensory, which comes from peripheral to the center. Peripheral to the center. So peripheral, we're knowing about this track of a spinal thalamic tract. We are knowing about track of a dorsal column and hemisphere. This track is followed to present this sensation. Now, where we are going to check the sensation? This sensation is checked on our arm, anteriorly and posteriorly. In anteriorly, we are going by using a dermatome levels, where we are going to check from center to the periphery. So we are going to check from here to here, or they can use in other ways also, from peripheral to center. So by this, we will come to know the picture where the involvement is. It is in peripheral or it is in center. So dermatome level give a sensory receptors to the where the sensation is intact or impaired. If the sensory is on your hand, you are taking examination like a touch, pain, temperature. If it is absent, so we can say, so it is nothing but your palmar digital, or the sensory involvement is present here. Fine. So this is nothing but your ulnar nerve C8 to T1. So if the patient having sensory loss and his forearm on the lateral side, so what will be there? That is lateral anterior brachicutaneous by C5, C6 supplied to the lateral of the hand. If you have a pinpoint at the level of palmar digital on your fingers, so we can check that sensation on this level, which will give suggest of median nerve C5 to C8. So this is the way we are going to assess our patient by using a sensory examination. This is for lower limb. For lower limb, anteriorly and posteriorly, we are going to check the sensation by using dermatome levels. How the sensation is going to feel. So it's light, crude, or it is thermal. So we are going to do a sensory examination while doing this activity. Now, what is sensory examination is? Sensory examination have three types. First is superficial, second is deep sensation, third is cortical sensation or combined cortical sensation. So superficial sensation have four things: pain, temperature, touch, and pressure. Superficial sensation have pain, temperature, touch, and pressure. Deep sensation having three: movement sense, position of sense, and vibration sense. So this is deep sensation. Okay. Next is cortical sensation, which is also called as combined cortical sensation. So combined cortical sensation is divided into tactile localization, sterignosis, graphesthesia, double point stimulation, 2-point discrimination, paragnosis, and tactile recognition. So tester recognitions is like the different structure with your touch, we are getting the sensation by that. Now, when you are checking superficial sensation, you should need some equipment to test it. For example, for pain, you need a safety pin. For temperature, we need a two test tube. One is hot and should be cold. For touch, we get a crude touch as well as soft touch. For crude touch, we need some crude object like reflex hammer back portion, or we can use touch response by using our cotton sap. Pressure, by giving a pressure over the skin and to measure the superficial sensation. Next is your deep sensation. It's about movements occurring or movement sensation. Movement sensation is like where your movement is occur. Upward, downwards, close to your body, away from your body, which joint is playing the role, which hand movements are playing a role, where is the sensory, so it's carried with your deep sensation. Next important part is cortical sensation. Cortical sensation is the involvement of superficial sensation and deep sensation. Cortical sensation have a tactile localization where the person had touch, sterignosis, what object is touching. For example, if you're touching a pain, so if you're touching pain, so you come to know, oh, this structure, it's a cap, it's a pain. So next is graphesthesia. If someone is drawing on your hands or on palm, like circular movement is drawn, so that is graphesthesia. Double point stimulation. If you got a stimulation on both the sides, you can feel it. 2-point discrimination. The both type discrimination can be present. Diagnosis means weight, how the weight of the object is, and textures like smooth, soft, skill, or different type of textures can be recognized. Now let us see in more detail how we are going to do it, how we are going to assess the patient. So first, ask the patient sensation is relation to pain, temperature, light, touch, vibration, position of 2-point discrimination. So what will be a rationale for this? This will indicate a lesion of alteration of along sensory pathway that is from peripheral through spinal cord to the brain. Then perform this assessment with the patient eye closed. Why we are making to close the eyes? Patient should be aware of sequence of sensation to be experienced. Next, conduct the procedure randomly. So patient will not get used to the things. If you're touching on this hand, now you're again touching for this hand. If you do randomly, he will be more conscious where he's going to be touching or where he's going to be say yes. To compare a symmetrical area of the body while applying a stimuli to the face, arm, leg, and trunk. To see the sensation along the with body surface are felt equally on both the sides. Record the patient's response and perception of the stimuli. Confirm actual perception of sensation. enables the examiner to identify a sensory defect. Next, how we are going to check it? Sensory examination like pain, temperature, light touch. We are going to use for pain, septic pain. First is ask the patient to tell you when it is dull or sharp sensation is felt. Next, alternately apply the point blunt of the pin to the skin surface. Note the area of numbness of increasing sensitivity. Where you have to take a precaution. The area where the skin is thickened, such as heel or sole of the foot, maybe have a less sensation to the pain. Next sensation we are going to check is temperature, where we have to take two test tubes. One test tube will fill with hot water, another will be cold water, where we are going to touch the patient's skin with a tube. Ask the patient or a client to identify it as hot or cold sensation. Precaution. You have to take that when you are performing this test, if the sensation is normal, go for it. Or you can omit this test while if your pain sensation is normal. Light touch, like cotton balls or cotton sap or a tip of a cotton, can be applied on the skin or different along the skin surface. Ask the patient to tell if the sensation is felt or not felt. Next, apply around the areas where the patient's skin is thin. It will be more sensitive. That is why the face, neck, arm, and top of the feet of the hands. Then we are going with the dips sensation. Can be checked by using vibration. So take a tuning fork of 256 Hertz. Apply vibration fork to the distal interphalangeal joint or the great toe. Be sure the patient is filled vibration, not merely pressure. Have a client and tell you when you are getting vibration is stop. Okay. So we saw sensory examination. In that we saw what? Pain by using a pin. Touch by using a what? We are going to use here. We are going to use cotton sap. Temperature by using two test tubes, and pressure, how much pressure we can apply. Okay. Sensory examination for deep sensation. For deep sensation, we are going to use movement sense, position sense, and vibration sense. We already talked about vibration sense. Let's talk about movement sense. We have to assess the patient. We have when we are coming to the patient, explain the movement, what the movement you are going to occur. Explain them properly. After explaining, tell them if this movement is close or open. Then tell the patient to close the eyes and tell them to perform the movement. Give a passive movement first. So tell me, it is open or closed. So the patient will say closed. So teach the patient. Repeat for thrice. Then come to the judgment. Position sense. Which position is maintained? It is close to your body or away to your body. And immediately tell them to perform on his another side to see deep sensation is working or not working. Next is your vibration sensation by using your tuning fork. Next sensory examination is cortical sensation, combined cortical sensation. One combined cortical sensation are tactile localization. So what is tactile localization? Means whenever some person or therapist touch the patient body or superficial area, this is called tactile localization. Okay, where he touch. Next is sterenosis, means what type of object is you are feeling. So I have given one example. What about a pain? If the patient have identification of pain, when he closes his eyes and see and palpate the pain, so you see, this is the pain. Okay. Next is graphesthesia. Again, I have given example before. Draw a circular or alphabets or number on his patient's skin and check for graphesthesia. 2-point stimulation. Use 2 pointers. See for the sensation is present or not present. 2-point discrimination by using acoustiometer to see, check for the distance measured between the two skins and see how the sensory is there. Diagnosis is like weight, how much weight the object have. If the one hand is folded with the pen and another hand is folded with the pen and another hand is folded with the phone, see whose weight is more. Next is texture recognition. Same for the cloth. It is soft, rough, or silk cloth is present. So this is the way we are going to see the examination on a different level. We have to check on a dermatome level of the patient, of upper limb, lower limb, as well as for trunk. There is some grading present. It says that grade 1, grade 2, grade 3, grade 1, if you are talking about, so it is light touch or crude touch, it is present, absent, or impaired. Thank you.